Like and subscribe and click the bell icon to get new video updates.
Great turmoil, dozens die in North Korea as Kim admits scale of COVID outbreak by Josh Smith and Byung-guk Kim updated May 15, 2022, 12.19 first published May 14, 2022, 10.28 p.m. Save login, register or subscribe to save articles for later. Share normal text size, larger text size, very large text size. Seoul, North Korea said on Sunday a total of 42 people had died as the country began its fourth day under a nationwide lockdown aimed at stopping the impoverished country's first confirmed COVID-19 outbreak. North Korea's admission on Thursday that it is battling an explosive COVID-19 outbreak has raised concerns that the virus could devastate a country with an under-resourced health system, limited testing capabilities and no vaccine program. Kim Jong-un attends a meeting on antivirus strategies in Pyongyang on May 14. Credit KCNA via AP state news agency. KCNA said the country was taking swift state emergency measures to control the epidemic, but there is no sign that Pyongyang was moving to accept international offers of vaccines. All provinces, cities and counties of the country have been totally locked down and working units, production units and residential units closed from each other since the morning of May 12 and strict and intensive examination of all the people is being conducted, KCNA reported on Sunday. A day earlier, North Korean leader Kim Jong-un said the spread of COVID-19 had thrust his country into great turmoil, and called for an all-out battle to overcome the outbreak. Despite the lockdowns, Kim and other senior officials on Saturday attended funeral services for Yang Hyong-sop, a former de facto head of state during the rule of Kim's father, Kim Jong-il, KCNA reported. A teacher takes the body temperature of a schoolgirl before entering a school in Pyongyang late last year. Credit, AP health authorities set up more epidemic prevention posts, and urgently transported medical supplies to hospitals and clinics, while senior officials had donated reserve medicines, KCNA reported. A large proportion of the deaths have been due to people careless in taking drugs due to the lack of knowledge and understanding of stealth Omicron variant virus infection disease and its correct treatment method, the report said. Korean Central Television on Saturday night broadcast treatments for the fever. A doctor at Kimanu Hospital suggested gargling with salt water, and taking different medications in case of high temperature, headache and muscle and joint pains. KCNA also suggested drinking Lonicera japonica tea or willow leaf tea 3 times a day. At least 296,180 more people came down with fever symptoms, and 15 more had died as of Sunday, the outlet said. Experts say North Korea appears to lack the capacity to test those tens of thousands of symptomatic patients. KCNA did not report how many of those suspected cases had tested positive for COVID-19. Overall, North Korea has reported 820,620 suspected cases, with 324,550 still under medical treatment, KCNA said. North Korea had previously claimed no confirmed cases of the virus, and is one of only 2 countries in the world that have yet to begin a COVID vaccination campaign, according to the World Health Organization. China and Russia are among countries offering help with vaccines, but Pyongyang has not publicly sought assistance. Its self-imposed lockdowns have slowed trade to a trickle and raised concerns about food shortages or other hardships, aid organizations have said. Kim said on Saturday that the crisis had been caused by the incompetence and irresponsibility of party organizations, but transmission was not uncontrollable and the country must have faith in its battle to overcome the crisis in the shortest possible period. Kim reportedly offered to donate his family's medical supplies for families experiencing hardship with his resolution to always share the destiny with the people. Reuters. Thank you for reading the Herald. This article is complimentary. Register or log in now to read more articles and unlock extra benefits. No payment required. Read more. Continue with Google, continue with Apple, or email address continue by continuing. You agree to your personal information being collected under a privacy policy and accept our terms of use. Hide content.